Hello, this is Dr. Tall Paul Simon, psychiatrist. Wanted to talk to you a little bit about ECT or electroconvulsive shock therapy. First of all, I want to start by saying I am a psychiatrist, licensed and board certified, and I've been treating patients mostly on an outpatient basis for about 13 years as of 2024. So ECT or electroconvulsive shock therapy has been around a long time. It's been depicted in various lights in media and social media and in popular press for a long time. It is still used and underutilized according to experts because it is so effective and relatively safe. Now, electroconvulsive therapy, when is it used? It is used for severe treatment-resistant or severe acute immediate life-threatening mental illness. So, for instance, if somebody is extremely depressed, they would be a candidate for ECT, perhaps if they're suicidal or a danger to themselves or others, or heading that way, and maybe they haven't responded to medications. Other instances that it can be useful is, let's say somebody is starving to death because of their anorexia, or they're so psychotic due to schizophrenia or mania that they're unable to take medications, or they're aggressive or violent or threatening to themselves or others, and there's really not many other options at that point. Let's say they're not responding to injections even and they're hospitalized. So ECT is reserved for these generally more severe cases. Now, what is ECT? Okay, now ECT is basically where the physician induces a seizure, a convulsion, a convulsive seizure. And a seizure is where all the neurons of the brain are all firing at once and releasing all kinds of neurotransmitters all over the place. Now, it's quite chaotic what happens in the brain, and it can lead to convulsions. That's why they call it electroconvulsive therapy, okay? Now, it sounds quite extreme, and it is to some degree. And it used to be that before paralytics were medicated, you can give them medication so they don't have the convulsions. It used to be dangerous, because if you're convulsing around as you're getting the electroshock treatment, you can injure yourself. And so that's back in the 60s and 70s, they would have to tie the person down and hold them down so that they wouldn't injure themselves during the treatment. Nowadays, we have medications and anesthesia where the person is just rendered unconscious, like anesthesia, and they don't thrash around at all. So it's much less risky than it was for that reason in the past. Now, electroconvulsive shock therapy is done as on an outpatient and inpatient basis, and I'll get a little bit more in a few minutes into how that works. But as far as how the therapy works itself, they don't know exactly, like a lot of these medications and different treatments, they don't know exactly how it works or why it works. They just know that it does work, okay? Now, it doesn't work 100% for everybody, just like anything, but it really is a very effective treatment for severe depression. Now, how it works is basically with all that firing of the neurons all going on at once. The way I think about it is just an overwhelming signal that overrides everything, so that the pattern of thought, being depression or psychosis, that has predominated in that brain up to that point is disrupted, and the brain is reset in a way so that it has a chance to reset at a more normal activity level and pattern of firing and thought. So an analogy that I think is useful in the way I think about ECT and the way I explain it to it is like resetting a computer. So let's say You have a computer or your phone and you're using an app and it freezes, okay? Now, it doesn't happen as much anymore, but I'm old enough to remember when my computer used to freeze a lot. And so when that happens, it just freezes and it's stuck and it can't do anything and it's just broken down. You can't do anything with it. So when that happens, you have to do a hard reset and basically reboot the computer. Okay, you used to have to unplug it, but now just a hard reboot. Hold on to the on/off button, the power button. But in a way, the ECT is like a rebooting of your computer. If you think about the computer as a big squishy, the brain is a big squishy computer. A cruder analogy that I sometimes use with my more familiar patients is almost like unclogging a toilet. Okay, sometimes you got to break out the plunger and do what you got to do, and it's kind of gross, but you have to get it unclogged. I like the rebooting of the computer analogy a little bit better. I think it's more elegant and perhaps more appropriate. So yeah, ECT is very effective. It's used still quite a bit. And again, experts say that it's not used as much as it should be because of its efficacy and relative safety. Now, let's say you're working with a psychiatrist such as myself, and they might say, oh, I think you might be a candidate for ECT. You've tried a few medications and your depression is really severe and you're not responding to the medications. I think we should talk about ECT. Okay, how is that done? All right. Now, if you're so sick, if the person is so sick that you end up in the hospital, maybe because of suicidality or psychosis or something, that's the quickest way to get ECT. And not all hospitals do it, but a lot do, at least in the bigger cities and stuff. And so you would need to get medically cleared because you're going to have anesthesia. You're going to be basically put under for about 15 minutes at the most. So chest x-ray, blood labs, and EKG to test your heart functioning, that can all be done relatively quickly in the hospital setting. And so let's say you're in the hospital, you go to the ECT suite, they put you on a little gurney and make sure you're comfortable and start an IV and give you the medicine and knock you out. And then they have several electrodes, usually on one side of the head, and they give a very mild current, and it induces a seizure. And usually the seizure lasts, 50 seconds, something like that. So it's pretty brief. And they have the medicines, all that available in case anything goes wrong. You have an anesthesiologist, you have the psychiatrist, or whoever's administering the ECT there. So you have a suite of nurses and a lot of staff there, and but the risk of complications is very low. Now they want to make sure you don't have like a lung infection or a severe heart issue or sepsis or something like that. That's why the medical clearance is necessary, but they want to make sure you're relatively medically stable. But even those who are not, that healthy, generally speaking, can benefit potentially from ECT. So discussing that with your psychiatrist or physician is what you would do about that if you're interested. But as an outpatient, it's a little bit more challenging because you have to get that medical clearance ahead of time. So a lot of primary docs can do that. They just need a primary doc's blessing, basically saying that, okay, yeah, this person is medically stable. They can undergo an outpatient anesthesia. And it still requires some blood labs and EKG and a chest x-ray just to make sure there's no signs of pneumonia or lung problems that are higher risk. As an outpatient, you can't drive home. It's kind of like getting a colonoscopy or something like that. And colonoscopy, actually, you're out under anesthesia longer than the ECT. So it's higher risk probably than the ECT. So as far as complications, the biggest thing is some memory issues. Now, if somebody is really, really depressed or psychotic, their memory is going to be pretty bad to begin with because of the condition itself. So according to studies, when ECT is used in these circumstances, the memory functioning actually improves because as the depression or psychosis or whatever improves, their cognition improves. Now, if somebody doesn't have really a lot of cognitive symptoms of their illness, sometimes people can have a little bit of memory dysfunction from the ECT. I mean, it basically reboots your computer. It scrambles not the neurons, but the signaling for, a minute or so. So a lot of times people, during the few weeks that they are undergoing the ECT, usually 3 times in a week, usually about a dozen treatments, their memory of that time of their life may be a little bit fuzzy. But generally speaking, most people, their memory fully recovers. About 30% of people during that stretch of time, during that ECT, those weeks, it can be a little bit fuzzy. So, though I've had some people say that long-term their memory is not quite as good. I don't know how much of that is, perception versus reality. It's hard to say, but that's the main risk for the procedure, other than the anesthesia itself. So there are 2 main types of ECT. There's unilateral and bilateral. So unilaterally is like on one side, okay, and they just do that, and then they stimulate the one side, and the seizure, crosses over to the both sides. That one is less likely to cause side effects or memory problems in that, or headaches or anything, than the bilateral. So bilateral is both sides, and that is more effective, but more likely to have side effects. So usually people will start with the unilateral first and see how it goes and see if it improves. And then if not, after 10 treatments, they may elect to go to bilateral. Now, if ECT is used and it's found to be helpful for the person, and they, let's say, recover from the depression, but they fall into depression again later on, maybe months later, you can decide to do ECT again. And then the option would be to have what we call maintenance ECT. So maintenance, basically the idea is to prevent a recurrence of the depression by occasionally doing ECT treatments. So when somebody's really depressed and they need ECT, they'll have usually 7 to 12 treatments to try to get them out of it. If that works, then you're golden, and you may or may not need maintenance. So maintenance usually occurs once every 2 weeks or once a month, or sometimes once a week, but that's a little bit unusual. Again, if that depression comes back and the ECT is the only thing that really seems to work for that person. So overall, ECT is an underutilized and very effective treatment for depression and other conditions that are not responding to medications, primarily that are life-threatening or severe. So try to keep it in mind and discuss it with your psychiatrist if you need to, or other physicians. It's not as scary as a lot of people think it is, and it's definitely not like it was depicted in movies like One Flew Over the Cuckoo's Nest. It's just not how it is. It may have been back in the 60s, perhaps a little bit like that, but a lot has changed since then. That's 50 or 60 years ago, okay? So things have vastly improved nowadays, and it's a lot safer and better tolerated for some of the reasons, and others. So keep it in mind, and we'll talk later. Hope you guys do well, and yeah, I'll talk later. Take care.